I remember the exact moment it happened. I was standing in front of the mirror, brushing my teeth like I had done thousands of times before. Nothing felt different. Same routine, same movements, same bathroom, same pale light, same half-asleep version of myself going through the motions. But then I saw it. A faint trace of red in the foam. Subtle, easy to ignore. And for a second, I almost did. But something about it didn't sit right. Because deep down, I knew, the body doesn't send signals without a reason. At first, I tried to rationalize it. Maybe I brushed too hard. Maybe it's just the new toothbrush. Maybe it's nothing. That's what most people tell themselves. And honestly, that's exactly how it starts for almost everyone. Quiet, discreet, harmless looking. But what I didn't realize back then, and what most people don't, is that bleeding gums are rarely just bleeding gums. They're often the first visible sign of inflammation. And inflammation, when ignored, doesn't stay small. It grows. The signal most people dismiss. Here's what nobody tells you when you're growing up. Your gums aren't supposed to bleed. Not from brushing. Not from flossing. Not even gently. Healthy gum tissue is firm, pale pink, and resistant. When it bleeds, even a little, it means something is already happening beneath the surface. Think about it this way. If your skin bled every time you rubbed it lightly with a towel, you'd know immediately that something was wrong. You wouldn't shrug it off and go make coffee. But somehow, with gums, we've been conditioned to accept bleeding as normal. It's not. And that misunderstanding? It's costing people their teeth. What makes this even more dangerous is how silent the progression can be. You don't wake up one day with severe dental problems. It builds slowly, beneath the surface, plaque accumulating along the gum line, bacteria triggering an immune response, the gums becoming irritated, swollen, and more fragile over time. Day by day, week by week, often without pain. This early stage is commonly known as gingivitis. And here's the part most people never hear clearly enough. Gingivitis is reversible, but only if you catch it in time. If not, it can evolve into something much more serious called periodontitis. And that's when things change. Because at that point, it's no longer just about bleeding. The infection begins to affect the structures that support your teeth. The gums can start to recede. The bone underneath can weaken. Teeth may become loose. And for many people, this is when fear sets in. The fear of losing teeth. The fear of smiling less. The fear of people noticing something is wrong. What nobody connects, but should. What makes it worse is that this doesn't just stay in your mouth. There's growing scientific evidence showing connections between gum disease and systemic health issues. Chronic inflammation in the gums has been associated with conditions like cardiovascular disease, diabetes complications, and even respiratory issues. Let that land for a second. The same inflammation happening quietly in your gums right now may be sending signals, bacterial signals, inflammatory markers, into your bloodstream, reaching your heart, affecting how your body manages blood sugar, influencing how your lungs respond to pathogens. Your mouth is not isolated from the rest of your body. It's connected to everything. Researchers have found that the bacteria responsible for gum disease, specifically a strain called Porphyromonas gingivalis, has been detected in the brains of people with Alzheimer's disease. That doesn't mean gum disease causes Alzheimer's, but it does mean the connection is being studied. Seriously. By serious people. It means your oral health is being taken more seriously by science than ever before. And yet, most people still treat their mouth as a separate department. Something you handle twice a year at a dentist appointment, if at all. Something you manage with a quick brush and whatever mouthwash smells the least like medicine. And that disconnect between how important oral health actually is and how little attention most people give it is exactly where the problem lives. The moment I stopped rationalizing. At some point, I realized I couldn't keep ignoring it. Because ignoring it doesn't make it go away. It just gives it time to get worse. And if you're watching this right now, there's a good chance you've noticed something similar. Maybe a little bleeding. Maybe sensitivity. Maybe even bad breath that doesn't fully go away no matter what you try. That's not random. That's your body asking for attention. And here's the thing about bad breath. Chronic bad breath, the kind that persists even after brushing, that's often a sign of bacterial overgrowth. Not a sign that you ate too much garlic. Not a sign that you need stronger mint. It's a sign that your mouth's bacterial ecosystem is out of balance. There are hundreds of species of bacteria living in your mouth right now. Most of them are harmless. Some are actively beneficial. But when inflammation is present, the harmful strains tend to thrive, feeding on the same irritated tissue, deepening the infection, and producing the volatile sulfur compounds responsible for that persistent smell. In other words, the breath issue and the bleeding issue? Same root cause. Same environment. Same signal. We've left a practical guide in the first link in the description. Click to access it quickly. What I got wrong about fixing it. When I finally decided to do something, I made a classic mistake. I brushed harder. I thought if the problem was bacteria and plaque, then more force would remove more of it. More scrubbing would mean cleaner gums. More pressure would mean faster results. I was completely wrong. Because aggressive brushing doesn't clean better, it damages. The gum tissue is delicate. When you brush too hard, you're not removing infection. You're injuring healthy tissue, causing what's called gingival abrasion, tiny microtraumas that actually make the gums more vulnerable, not less. Over time, aggressive brushing can cause the gum line to recede, exposing the roots of the teeth, increasing sensitivity to hot and cold, and creating conditions where bacteria have even easier access to deeper structures. I was trying to solve a problem and making it worse. That's not unusual. That's actually very human. So let's talk about what actually works. The real foundation of gum health. It wasn't about brushing harder. It was about brushing correctly. Gentle, thorough brushing twice a day, with a soft bristled toothbrush, focusing on the gum line. Not just the flat surfaces of the teeth. The gum line. Because that's where plaque builds up. That's where the inflammation starts. That's where your attention needs to go. The technique matters too. The base method, where you angle the bristles 45 degrees toward the gum line and use small circular motions, has been shown to be more effective at disrupting plaque at the gum margin than horizontal scrubbing. 2 minutes. Every time. Not the 30 seconds most people actually brush. Studies suggest the average American brushes for just 45 seconds. That's not enough time to cover all surfaces, reach the gum line properly, and allow the fluoride in toothpaste to have meaningful contact with the enamel. Set a timer if you have to. 2 minutes feels longer than you'd expect. And then there's flossing. Flossing is not optional. I know that's not what people want to hear. But the spaces between your teeth, your dentist calls them interproximal spaces, are completely inaccessible to a toothbrush. You can brush perfectly and still leave 35% of your tooth surfaces untouched. That's where plaque hides. That's where tartar builds. That's where gum disease often begins. And once plaque hardens into tartar, a process that can happen in as little as 24 to 72 hours, no amount of brushing at home will remove it. It mineralizes. It bonds to the tooth surface. Only a professional cleaning can get it off. Which means that if you're not flossing daily, you're essentially handing bacteria a 35% head start. Every single day. What lifestyle has to do with it? Another thing that surprised me was how much lifestyle plays a role. Diet, for example. High sugar intake doesn't just cause cavities. It actively feeds the harmful bacteria in your mouth. Streptococcus mutans, one of the primary cavity-causing bacteria, metabolizes sugar and produces acid as a byproduct. That acid attacks enamel. It also creates an acidic environment in which other harmful bacteria thrive. But it's not just sugar. Highly processed, refined carbohydrates, white bread, crackers, chips, break down into sugars quickly. Sticky foods that cling to teeth give bacteria prolonged access to fuel. A diet rich in fiber, vegetables, and whole foods does the opposite. Crunchy vegetables like carrots and celery actually have a mechanical cleaning effect on teeth. Leafy greens are high in calcium and folic acid, both of which support gum health. Then there's smoking. Smoking is one of the most significant risk factors for gum disease, and one of the most misunderstood. Most people think of smoking and teeth in terms of staining. But the real damage goes much deeper. Nicotine constricts blood vessels in the gums, reducing blood flow. That's why smokers' gums often don't bleed as much even when disease is advanced. It's not because their gums are healthier, it's because the blood supply is compromised. The immune response is weakened. The gums can't fight infection as effectively. And healing, when treatment is sought, takes longer. Smokers are up to 7 times more likely to develop periodontitis than non-smokers. 7 times. And vaping, because this question always comes up, is not a safe alternative when it comes to oral health. The aerosol contains compounds that have been shown to cause oxidative stress in gum tissue and disrupt the oral microbiome. Stress is another factor that rarely gets talked about in the context of oral health. Chronic stress elevates cortisol levels. Elevated cortisol suppresses the immune system. A suppressed immune system has a harder time controlling inflammation, including inflammation in the gums. Stress also tends to correlate with teeth grinding, which places excessive pressure on gum-supporting structures. And then there's sleep. During sleep, your body undergoes significant immune and regenerative activity. Saliva production drops, reducing its natural protective effects. But restorative sleep is also when inflammatory processes are regulated. People with sleep disorders have been shown to have higher rates of periodontal disease. Everything is connected. Your gums are not a standalone system. They're a window. The emotional weight nobody talks about. Here's the part one want to spend some real time on. Because nobody talks about it. Not dentists. Not health blogs. Not anyone. The emotional side of gum disease. When your gums bleed, there's a visible signal. And visible signals, even ones only you see in the bathroom mirror, have a psychological weight to them. They create a low-grade, persistent anxiety. A background noise of self-consciousness that's hard to name but impossible to ignore. You find yourself smiling differently in photos. Slightly closed. Slightly guarded. You're aware of your breath in a way you never were before. Before a meeting. Before a first date. Before a conversation with someone you want to impress. You pull back slightly during moments of closeness. And you don't necessarily tell anyone. Because it's not the kind of thing people discuss. It's not dramatic enough to bring up. But it's present. Quietly. Consistently. Over time, that self-consciousness accumulates into something that affects how you move through the world. The way you hold your face in conversation. The way you laugh, mouth open or mouth closed. The way you feel when someone stands close enough to talk to you and you suddenly can't stop thinking about whether they can smell something you can't fully control. That's real. That's happening to millions of people right now. And it's almost never addressed directly, because the medical conversation focuses on the clinical. The bacteria. The bone loss. The intervention protocols. But you're not just a set of teeth and gums. You're a person who deserves to smile without thinking about it. We've left a practical guide in the first link in the description. Click to access it quickly. The progression nobody sees coming. Let's talk about what happens if nothing changes. Because most people who develop serious periodontal disease didn't choose to ignore it. They simply didn't know what was happening until it was already advanced. Stage 1 is gingivitis, reversible, as we discussed. Inflammation of the gums. Bleeding. Redness. Swelling. Addressed correctly, the gums can return to full health. Stage 2 is early periodontitis. At this point, the infection has begun to affect the periodontal ligament, the tissue that connects the tooth root to the bone. Pockets form between the gum and the tooth. Bacteria move deeper. This requires professional treatment, but can still be managed effectively. Stage 3 is moderate periodontitis. Bone loss is visible on X-rays. Pockets are deeper. Teeth may begin to shift position because the support structures are compromised. Treatment is more complex. Recovery takes longer. Stage 4 is severe periodontitis. Significant bone loss. Teeth may be loose. Some may need to be extracted. Surgical intervention may be necessary. And even after treatment, the structural damage that has occurred cannot be fully reversed. Most people don't realize they're moving through these stages, because the early stages are often painless. Pain is typically the last signal the body sends, not the first. By the time something hurts, the process has usually been underway for months or years. That's why the early signal, the bleeding, the sensitivity, the persistent breath issue, matters so much. Because catching it at stage 1 or 2 is a completely different situation than catching it at stage 4. What professional care actually looks like. At a certain point, home care alone isn't enough. If tartar has already built up, and for most adults over 30, some degree of it has, you need professional intervention. A routine dental cleaning, called a prophylaxis, removes surface tartar and polishes the teeth. But if gum disease is already present, a more thorough procedure called scaling and root planing may be recommended. This goes deeper, cleaning below the gum line, removing plaque and tartar from the root surfaces, smoothing the root to help gum tissue reattach. It's not a punishment. It's a reset. After a scaling and root planing treatment, patients who maintain good home care can often stabilize their condition significantly. The pockets can shrink. The gums can tighten. The bleeding can stop. But maintenance is ongoing. Most people with a history of gum disease need professional cleanings every 3 to 4 months rather than the standard twice a year. That's not because their dentist is trying to see them more. It's because the bacterial recolonization that triggers disease tends to recur on a 3-month cycle. Understanding this changes your relationship to dental care. It's not about checking a box. It's about interrupting a cycle. And if you haven't seen a dentist in over a year, or over 2 years, which is increasingly common, the first appointment back will likely feel like a bigger deal than you remembered. That's normal. That's the gap closing. The right response is not to delay further. New research, new tools, and what's actually worth your money. The oral health space has evolved significantly in the last decade. Electric toothbrushes, for example, have been shown in multiple clinical studies to remove more plaque and reduce gingivitis more effectively than manual brushing. Not because the technology is magic, but because the consistent motion, built-in timer, and pressure sensors help people brush more correctly, more completely, more often. A 2-minute electric brush with a pressure sensor is often more effective than the perfect manual technique, because most people don't use perfect manual technique. Water flossers are another tool worth understanding. They don't replace traditional flossing entirely, but for people with braces, bridges, or difficulty maneuvering traditional floss, they offer a meaningful alternative. The pulsating water jet can disrupt plaque in areas that are otherwise difficult to reach. Antimicrobial mouthwash, specifically formulations containing chlorhexidine, is sometimes prescribed for short-term use during active gum disease treatment. But it's not a long-term daily solution. Overuse can disrupt the oral microbiome and cause staining. It's a clinical tool, not a substitute for mechanical cleaning. And then there's a newer area of interest, the oral microbiome. Researchers are increasingly looking at oral health through the lens of microbial ecology, not just eliminating harmful bacteria, but supporting the balance of beneficial ones. Probiotic strains like Lactobacillus reuteri and Streptococcus salivarius K12 have shown early promise in studies for supporting gum health and reducing the dominance of pathogenic bacteria. This isn't science fiction. This is an active and growing area of research. The idea of seeding your mouth with beneficial bacteria to crowd out the harmful ones represents a fundamentally different approach than the traditional kill-everything-in-sight method. It's not ready to replace anything, but it's worth knowing it exists. What changes when you actually pay attention? Healing doesn't start with perfection. It starts with awareness. Because once you understand that bleeding is not normal, once you recognize it as a signal instead of an inconvenience, you begin to act differently. You pay attention. You adjust small habits. And over time, those small changes begin to compound. The inflammation reduces. The gums become firmer, paler, healthier. The bleeding stops. Not overnight. Not magically. But gradually. Realistically. Some people report significant improvement in gum health within just 2 to 4 weeks of consistent, correct home care. Not complete resolution, but measurable, visible change. The gums become less puffy. The bleeding becomes less frequent. The sensitivity decreases. That's the timeline. That's what's possible. And that possibility, the fact that this is not a permanent sentence, is something nobody hears clearly enough. Gum disease, caught early, is one of the most reversible common health conditions there is. That's actually good news, if you're willing to use it. The conversation you should have with yourself right now. By this point, you've learned more about your gum health in the last several minutes than most people learn in years. You know what bleeding actually signals. You know how the progression happens, slowly, silently, across stages most people never track. You know what worsens it and what helps. You know about the systemic connections, the emotional weight, the treatment options, the research frontier. So now the question isn't informational. The question is personal. What are you going to do with this? Because there's a version of you that closes this video and goes back to the same routine. Same 45-second brush. Same skipped flossing. Same rationalization when the pink appears in the foam. And there's another version of you that takes this seriously. Not because it's dramatic. Not because you're in crisis. But because you now understand that small signals are worth respecting. That the body communicates in whispers before it starts screaming. That the window of easy intervention is right now, not after it progresses further. That your smile is worth protecting before you lose it. One more thing before you go. There's something I want to say to the people watching this who haven't been to a dentist in a long time. Maybe it's been 2 years. Maybe it's been 5. Maybe longer. Maybe there's fear involved. Dental anxiety is real and it's more common than you think. Studies suggest up to 36% of the population has some degree of it, and nearly 12% have extreme dental fear. Maybe there's financial concern. Dental care in the United States is expensive, and coverage is inconsistent. That's a real barrier that deserves acknowledgement, not dismissal. Maybe there's shame. The longer the gap, the heavier the anticipation. They're going to judge me for waiting this long. They won't. Dentists see patients at every stage. Their job isn't to make you feel bad about the past. It's to help you from wherever you are now. The conversation you've been avoiding gets easier the moment it starts. And there are options. Community dental clinics. Dental schools where supervised students provide care at significantly reduced cost. Payment plans. Preventive-focused programs. The point is, not going is not neutral. Every month that passes is another month of silent progression. If cost or fear is the barrier, name it. Say it out loud to yourself. And then look for a path that addresses it directly, rather than one that delays the inevitable. Because the most expensive dental care is the care that's needed after years of avoidance. Prevention is not just medically superior. It's economically rational. The signal was never the problem. Let's end where we began. That trace of red in the foam. It wasn't the enemy. It wasn't the thing to be afraid of. It was information. And information, used correctly, is power. Your body is doing that right now. Sending signals. Asking for attention. Communicating in the only language it has. Physical sensation, visible symptoms, things that don't feel quite right and haven't for a while. Bleeding gums are not the problem themselves. They're the warning sign. And warnings are opportunities. Opportunities to prevent. To adjust. To take control before things escalate. So if there's one thing to take from everything you just heard, it's this. Don't ignore what seems small. Because small signals, understood early, can save you from much bigger consequences later. You don't need to wait for pain. You don't need to wait for it to get worse. You don't need to wait for the moment when fear finally overrides denial. You can start now. Right where you are. With the next time you pick up a toothbrush. With the next time you look in the mirror. With the decision, quiet, private, no audience required, to take yourself seriously. Because you're worth that. Your health is worth that. And your smile, the one you've been holding back, is worth protecting. We've left a practical guide in the first link in the description. Access it now, before you forget. Click the link. If this changed the way you see things, subscribe to the channel. Because this is just the beginning. We're going deeper into the signals your body gives you, the ones most people overlook, and how understanding them can completely change your health, your confidence, and the way you live every day. See you in the next one.